Hello, I'm Dr. Terry Simpson, and breast implants, silicone breast implants, were again in the news this week when the FDA met, generally to discuss with the two companies involved the poor number of patients involved in the follow-up of their studies. The FDA ultimately concluded breast implants were safe and came off of the assertion that women should have an MRI of the breast 3 years after placement of silicone breast implants and then every 2 years thereafter. Predominantly, the reason for that was because they felt that the cost of the MRI was prohibitive, and yet still agreed that MRI is the best study to determine about silicone breast implants. There were clearly some disagreements in there because some patients and women groups who testified at the meeting disagreed that silicone breast implants were safe simply because of the high rate of removal, scarring, pain, infection, and asymmetry that was followed. Dr. William Maisel, who's the chief scientist for the Food and Drug Administration Center for Devices, disagreed, thinking that silicone breast implants were safe, but chided the two companies that were involved in silicone breast implants, Johnson & Johnson and Allergan, saying that they had done a poor job of studying patients who got the implant, as the FDA had required them to do. In addition, they agreed that the companies had failed to follow as many patients as the agency had hoped. The committee felt that their backing off on the 3-year for getting implants, getting the MRIs for implants and every 2 years following, was predominantly because MRIs are expensive, and it was not clear what a woman should do once an unseen rupture is discovered. The risk associated with ruptured implant may not be greater than the risk of the operation for removing that. Nevertheless, the FDA has not decided whether they're going to follow that advice or not. Bottom line, in a multi-million, if not billion-dollar cosmetic industry of breast implants, Allergan and Johnson & Johnson, for some reason, chose not to do a study where they paid patients or physicians to follow them to get adequate information regarding breast implants. That's not good. That's big pharma at its worst. I'm Dr. Terry Simpson. That's your doctor's orders.